Many people with diabetes know that they need to be exercising to help manage their blood sugar and help to improve other areas of health. But this can become challenging if diabetes-related foot ulcers develop. I'm going to cover what the latest research says about exercising with foot ulcers in terms of the safety and the effectiveness. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. Diabetes-related foot ulcers, these develop because when blood sugar stays at high levels over time, this can lead to poor blood circulation as well as nerve damage caused by neuropathy. Because a loss of sensation in the foot happens under these conditions, even just a minor cut or a small wound to this affected area, it can go unnoticed for a long period of time, which can lead to a foot ulcer, which can take quite a while to heal. Now, it's important for people with diabetes to continue to exercise with the foot ulcers, under certain conditions, of course, because the exercise is going to help improve blood sugar management, heart health, and it can also help to speed up the wound recovery process of the foot ulcer. Now, this faster healing process is thought to happen because exercise can help to reduce stiffness of the arteries, which helps to improve blood flow, and it can also help to improve the function of the blood vessels that are found within the skin. Both of these processes help to deliver nutrients and oxygen to the wound site, which is necessary for healing. Other ways that exercise is thought to help speed up the recovery process is through its anti-inflammatory effects that it has on the body, as well as its ability to improve blood sugar levels. Even though exercise can have benefits in people with foot ulcers, there are also some risks that come along with exercise, and we want to minimize these risks because we don't want repeated trauma to the foot in people who have peripheral neuropathy or peripheral artery disease. People with foot ulcers are often told to either not exercise or to make modifications to the exercise in order to reduce any pressure that's put on the foot. And when these modifications are in place, it can be difficult to meet the physical activity guidelines for diabetes. Depending on which organization we're talking about, the exercise recommendations for people with foot ulcers, they include doing water-based activities, using a cycle ergometer, which is essentially an exercise bike that's used in exercise science labs, and wearing some type of shoe, boot, or orthotics that helps to shift that weight away from the ulcer. The American Diabetes Association, they currently recommend that people who have an unhealed ulcer should avoid doing any type of weight-bearing activity. Now, this is a difficult area for clinicians to make recommendations in because there hasn't been much research that is focused on exercise in people who currently have foot ulcers. There was a systematic review in 2025 by Baker and colleagues that included 8 different exercise interventions in people who currently had diabetes-related foot ulcers. Now, of these 8 studies, only 3 of the studies were randomized controlled trials. And this type of study design, this gives us the highest quality evidence in terms of determining intervention effectiveness. In terms of safety, out of the 213 participants that were included in this review, only 1 participant had issues with their ulcer, and it was a temporary increase in fluid leaking out of blood vessels in tissue that was near the ulcer. In terms of wound healing, exercise may help with the healing process in diabetes-related foot ulcers, but overall, the evidence is considered weak at this point. And that's because only 7 of the included studies actually looked at this outcome in terms of does exercise improve wound healing. All 7 of the studies were conducted very differently, and some of them, they didn't do a very good job of describing how they actually did the study. So it makes it difficult to replicate. And so all these factors together, it makes it difficult to draw any firm conclusions. There was only 1 study in this review that looked at how exercise impacts blood sugar management while somebody with diabetes has foot ulcers. This was one of the randomized controlled trials, and so it had 2 different groups, 1 intervention group, which means this was the group that actually exercised, and 1 control group that didn't exercise. It was a 12-week aerobic exercise intervention, which means cardio, and both groups had diabetes and they both had foot ulcers. The experimental group, they rode on an exercise bike with a specialized offloading insole padding in their shoe to reduce any pressure on the foot ulcer. They started them off with only 10 minutes of exercise after the warm-up and then built up to an intensity that felt somewhat hard, which is considered moderate intensity. They then gradually increased the time spent exercising until they reached 50 minutes a session in week 9, and they continued this through week 12. At the end of the 12 weeks, the exercising group had significantly improved healing with the foot ulcer, and that was measured by a decrease in the size of the foot ulcer, and they also had significantly lower fasting blood sugar compared to the control group. The other 2 randomized controlled trials, these both focused on exercises that improved foot and ankle range of motion. And only one of these studies resulted in significantly improved wound healing in the intervention group compared to the control group at the end of 12 weeks. Overall, exercising with a diabetes-related foot ulcer, it seems to be safe, and it may also promote wound healing of the ulcer when certain precautions are taken. Now, this is an area where a lot more research needs to be done, specifically in people with diabetes who currently have foot ulcers, in terms of looking at how the exercise can improve blood sugar management, fitness levels, and promote healing of the wound itself. Make sure that you follow any exercise recommendations that are given by your doctor. Thank you for watching.